So today we're going to talk about experiments and how to design experiments, how to talk about experiments, everything around this big idea of experimental design. So some basics about experiments. Some things that you have. First of all, you have a treatment. And a treatment in an experiment is what you're actually doing to the subjects that you're studying. So it's that idea that you're studying. The response is how the subjects that you're studying respond to the treatment. So for example, if your treatment was to fertilize your grass with a particular fertilizer once a week, the response would be how your grass grew. One thing that you definitely want to know about experiments is experiments are the only way to determine cause and effect because you are controlling everything. You can't determine cause and effect just by studying something. You have to actually control things in order to determine cause and effect. That's why we don't just go out and study medication that people are on to determine whether it is effective. We actually have to perform an experiment where we're putting people on medication and then we're putting another group of similar people on a placebo. So if you're just studying what's already going on, that's called an observational study. So you're not actually applying a treatment, you're just studying what is already in place. That's an observational study. An experiment is where you are actually applying a treatment to a set of subjects. So one of the things you need to make sure you always have in an experiment is you need to always have a control group and a comparison group. So a control group and a comparison group, those are the groups that you use to compare what you're studying. So a control group would be a group where you have nothing else going on. So in a control group, that would be where you're giving them a fake pill or a placebo. Or a control group would be where you're not fertilizing your grass, you're just letting it grow as normal. A comparison group would be where you have a group that you're comparing to, but maybe the standard is to fertilize your grass once a month with the normal fertilizer, and you're comparing your treatment is to fertilize it twice a month with this same fertilizer. Your comparison group would be the original group, the way that things are being done already. So fertilizing once a month. A treatment group is the group in the experiment that you're actually applying the treatment to. So in the grass example, it would be where you're fertilizing twice a month. It's what you're trying to prove whether it works. That's your treatment group. Most of the time in medical examples especially, you have either a blind or a double-blind experiment. A blind experiment is where the patients receiving the treatment or the subjects receiving the treatment don't know whether or not they received the actual treatment or whether they received the placebo, the fake treatment. A double-blind study is where both the patient and the doctor don't know who received the actual treatment and who received the placebo. The benefit of that is then the doctor isn't going to treat you differently because they know for sure you got the pill or you didn't get the pill. So some more details on observational studies versus experiments. Observational studies, no treatment gets assigned to the units. The conditions of interest are already built into the units being studied. It's less desirable than experiments, but sometimes necessary. You're going to do an observational study you might do the observational study on the effects of tobacco on people. You're not going to force certain people to smoke and certain people to not smoke. You're going to observe what is already going on. You're not going to force patients to stop taking a particular medication. You're going to observe what's already going on. An experiment They're clinical trials. So you have a treatment and a control are assigned to the units, to the subjects of the experiment. So you're actually controlling what is going on. You're assigning the treatments, you're assigning who's the control group. More on observational studies. Observational studies can have bias in them. It's called, when there's a bias in an observational study, it's called confounding. And when an observational study has a confounding variable, they can lead to false conclusions. You need to try your best to protect against confounding. So you need to make sure that you have tried to protect against as many variables that could lead to bias in an observational study as possible. If an observational study is confounding, it's impossible to separate the two possible influences. They're mixed up. That's what confounding means, is mixed up. So if you're looking at an observational study and you can't determine which might be the cause, that would be confounding, where there's another influence that you're not studying that could be causing the results. So now we get back into experiments. And in experiments, you have factors and levels. So factors are the broader ideas, the big umbrellas of what you're studying. So for example, calories and length of exercise. Within your factors, you can then have levels for each of your factors. So if you're looking at a diet, you're studying different diets and exercise. So the two factors would be how many calories you take in and how long you exercise. You might study different levels of that, 1,500 calories or 2,000 calories, and 30 minutes or 60 minutes. So you really have then, if you have different levels, this creates multiple groups you have to study. You would need to study a group that's consuming 1,500 calories and 30 minutes of exercise, and you would need to study a group of 1,500 calories and 60 minutes of exercise, and you would need to study a group of 2,000 calories and 30 minutes of exercise, and a group of 2,000 calories and 60 minutes of exercise. A little bit more on the control group. A control group is a group for comparison in which no treatment or the standard treatment is provided. And again, blind is where the patient doesn't know whether it received treatment or placebo. And a double blind is where both the patient and the doctor do not know who received the treatment and the placebo. The reason why you need a control group, and when you're doing a medical study you need a placebo, is there's something called the placebo effect. And the placebo effect is mentally, if you think you are receiving treatment, you're going to get better. So there is research that shows that this placebo effect is true. Just thinking you're receiving treatment does make you better. So you have to have that control group, that placebo group, so that you can determine whether the medication is actually effective or just believing you're on medication is what's effective. These are elements of a well-designed experiment. You need to compare, which is where you have a treatment group that is compared to a control group or another treatment group. So you might compare two different treatments. You need to randomize, so you have to randomly assign the treatments. You need to replicate. You can't just assign the treatment to one subject or one unit and call it good. You need to have your treatments assigned to multiple units and multiple subjects. One thing that the reason why you have multiple subjects is to try and kind of take into account the variability in actual human error in experiments themselves. So you have two different kinds of variability. You have between treatment variability, which is the difference between the two treatments, and you have within treatment variability. That's the difference between units within a treatment. So that would be the difference between two people receiving the same medication and the way that they respond, as opposed to between treatment variability would be looking at how how subjects respond between two different treatments, maybe two different levels of medication. In order to reduce the variability, you need to make sure that it's balanced so that you have the same number of people in different kinds of treatment or in the treatment and the control group. You need to have a completely randomized design. So you need to make sure that your design is randomized. And then you can have things called blocks or randomized blocks, and we'll get a little bit more into that. So your design, completely randomized. If you have a completely randomized design, you number the available units 1 to however many. If you have 50 units, 1 to 50. You use a random number generator to assign your numbers, to assign your people to their groups. So if you have 50 people and 5 different treatments, you would do 10 people randomly into each group. Another possible design is a matched pairs design. A matched pairs, the first thing you do is you sort your available units or subjects into pairs of similar units. For example, you might do matched pairs where you have, you're matching them based off of gender and what they weigh now. So units should be enough alike so that you expect them to have similar responses to any treatment. So maybe you're matching them, and so that you've got a woman that weighs 150 and 2 women that weigh 150, and you'd have that be a matched pair. And 2 women that weigh 160, and that would be a matched pair, and so on. And then within those matched pairs, you randomly decide which of the 2 receives which treatment. If you are studying more than 2 different things, so you need more than a control group and a treatment group, you have multiple treatment groups, but you're still wanting this matched pairs idea, that would be a randomized block. So instead of just having 2 similar units, you would group them into similar units called blocks of however many you need in order to get through all of your treatments. So in that exercise and calorie experiment, you would need blocks of 4 similar subjects so that you could assign each of the different categories to each of the different treatments and levels to one of the people in that block. Then within that block, you randomly assign each of those treatments to each person in the block, and you would repeat it for each block.